Very much, Dr. McEwen. Our next speaker is Rob Milling, who is Director of Health and Nursing Policy with the Registered Nurses Association of Ontario. Rob.
Great, thank you very much, John. As a representative of registered nurses across Ontario, I'm proud to join my colleagues here to urge the federal government to reverse its decision to eliminate the mandatory long-form census. Nursing is a knowledge profession. Nurses depend on best evidence to inform best practices to ensure the best possible patient outcomes. Nurses know that the long-form census matters. It gathers credible data that is vital for making evidence-informed policy decisions. This information helps us better understand where people live, work, and raise their families, and how our country is changing over time. The data helps healthcare planners, researchers, and public health officials track the needs of Canadians. Every credible researcher in this country will tell you that you can't create robust health and social policy without comprehensive, scientifically valid evidence. And this evidence can only be gathered through the mandatory long-form census. Registered nurses are especially concerned about the impact these concerns will have on Canada's most vulnerable community members. And you've already heard about this from Dr. McEwen. The risk of having a voluntary survey is that vulnerable groups such as new immigrants, Aboriginal Canadians, those in lower socioeconomic groups will be undercounted. This will obstruct our ability to provide appropriate evidence-based health and social services. It clips the wings of health professionals who have come to understand using precisely the kind of information provided by the long-form census, the impact on health outcomes of societal trends such as the racialization of poverty, income inequality, and hours worked without pay. The Government of Ontario has actually stated that the loss of detailed, reliable data on income, employment, education, and housing will have a negative impact on the province's poverty reduction plan. Again, we know from the evidence that those living in poverty are at much greater risk of dying earlier and having significantly higher incidences of chronic diseases, conditions, and disorders. Simply, ending the mandatory long-form census is bad for our health. There's no viable alternative to the mandatory long-form census. The proposed voluntary survey will be biased, skewed, unreliable, and won't represent the population. Nurses know that the mandatory long-form census is a public good and a valuable public asset. The Registered Nurses Association of Ontario calls on the federal government to reinstate it for the greater good of all Canadians. Thank you.